morning. We'll do a test here. 1, 2, 3, 4, 5. Very good. Okay. Good morning, everyone. Welcome to our usual Friday update. And today I have with me, as is customary, County Executive Irma Budish, along with Dr. Heidi Gullett, our Medical Director, and our Co-Director of Prevention and Wellness, Ramona Brazil. And so I'd first like to hand the podium over to Executive Budish.
Thank you. Good morning, everybody. Today I join you with a heavy heart. It's only been a week since we've last been together, but it feels like a lifetime. Over the weekend and in the days since, we've witnessed scene after scene of justified outrage and sorrow over the senseless and inhumane murder of George Floyd. I've stated that while I don't support the destruction that's ravaged our downtown and ravaged other cities, I completely sympathize with the anger and pain that the African American community and indeed our entire country is feeling. So today and every day, I stand in solidarity with the Floyd family and all of those who have suffered injustices as the result of systemic racism. I offer my prayers and hope to his family and to our country. Let's face it, this country has not gotten past the perpetual pain and injustice that systemic racism produces. This racism is so deeply baked into our systems that many don't even see it, except, of course, those who are suffering from it. I'd like to give you an example. Here in Cuyahoga County, we have an infant mortality rate, babies who die before their first birthday, among African American women that is about four times the rate that applies to babies born to white women. That's not due to poverty, it's not due to lack of education. If you take a highly educated African American woman who has a good career, she's still more likely to lose her baby than a poor white woman with a high school education. Those are the facts. That's the data. You can't explain that disparity apart from structural racism. We, the county, we fund, along with the city of Cleveland, an initiative called First Year Cleveland. First Year Cleveland, the work of that organization is to try and fix this terrible disparity. And they're focused on the fact that structural racism is baked into our health system, it's part of our food system, it's basically pervasive. That's structural racism, and it's impacting African American mothers and babies' lives. We're here at the Board of Health. Last week, we heard from Deputy Director Ramona Brazil, who very starkly painted a picture of structural racism. We're seeing it daily in the COVID numbers that Dr. Gullett regularly talks about. It's here and across the country. This virus has revealed even more deeply than before the terrible disparities between care for African American and white people. The numbers don't lie. Structural racism doesn't just harm African Americans. It prevents us as a community from reaching our potential. We must all come together, regardless of race, religion, nationality. All of us must come together to defeat structural racism. I'm working with County Council right now to address this, not just with high-minded aspirational statements, but with practical actions. In the fight against the COVID pandemic, we've already begun. For example, with our increased funding for testing, we're reaching into neighborhoods with less access to health care. The Board of Health and Metro Health have been working with the Word Church, conducting tests in Warrensville Heights, with another set coming to East 55th Street in Cleveland. And our Small Business Stabilization Fund has also been providing a significant boost to minority businesses. But let me tell you, there's a whole lot more that we need to do. You'll be hearing more from me and the county in the coming weeks. Now switching gears for a moment. A few weeks ago, I announced a virtual job fair week coming up. We partnered with the Mandel Supporting Foundation at the Jewish Federation of Cleveland and with Ohio Means Jobs Cleveland, Cuyahoga County to create a virtual job fair for companies in Cuyahoga County, companies that are hiring right now. Cuyahoga County and the Mandel Supporting Foundation both contributed $150,000 to this initiative. The numbers are awful. Since the COVID crisis began here in March, over 130,000 people in Cuyahoga County have filed for unemployment. That's devastating. But we also know that there are lots of companies looking to hire thousands of people from Cuyahoga County. So we're trying to bring them together, the people looking for work and the companies offering work. And I'm pleased to announce that we have more than 80 companies who have signed on to participate in the virtual job fair week. These are companies that include the Cleveland Clinic, Amazon, Fifth Third Bank, Metro Health, University Hospitals, Giant Eagle, FedEx, and many others. The jobs are in a variety of sectors: healthcare, food service, banking, and construction, to name a few. The virtual job fair week launches on June 15th and goes through the 19th. Anyone looking for a job should go to the Ohio Means Jobs homepage, which is omjcc.us. That's omjcc.us. Click on the Job Seekers Register Now link to register. Here's how it works. Once you've signed up, registered, you can visit the virtual job fair at any time from June 15th at 9 a.m. through June 19th at 4 p.m. Upload your resume, upload a cover letter, and search open jobs. You can visit the virtual job fair anytime that fits your schedule, and there will also be recruiters, real people, available from the participating companies to chat with you from 9 a.m. to 4 p.m. each day that the fair is going on. If online access is a barrier, and it may be, especially for people who are poor and out of work, we've partnered with PCs for People, and they're distributing computers, hotspots, and 3 months of internet access, all free to those who are eligible. To find out if you qualify, you can call 216-319-5993. This virtual job fair week is just the first of many that we plan on partnering with Ohio Means Jobs, Cleveland, Cuyahoga County. Again, my sincere thanks to the Mandel Foundation for helping to make these critical services available. Thank you all very much.
Thank you, Armin, and thank you for your continued support and for your strong words related to equity and justice in the community. So yesterday, the state released a list of facilities and venues that are eligible to open on June 10th. The reopening is dependent on individual locations' ability to follow the consumer retail and service and entertainment guidelines that are applicable in the guidance from the state. These include venues like aquariums and art galleries, zoos, social clubs, museums, and the like. Day camps and residential camps may open at any time. It's important to note that the guidelines that are available at the state level are set to assure that these venues are taking every precaution they can to prevent transmission. And so it's important that people follow the guidelines even as we continue to open up to do the best we can here to prevent transmission and mitigate risk. This week, we heard from Governor DeWine say that he fully intends for schools to be in session this fall. I'm sure parents may welcome this sentiment. In order for this to happen, there are numerous considerations. Above all, the safety. Above all is the safety of the students and the staff. Many schools have reached out to us seeking answers, and we're also waiting for the pending guidance and instruction from the state. We know that there are discussions at the state level with a variety of stakeholders to determine the best way to make this happen. We also know that the governor has stated that they'll be watching the numbers. And if there are surges that occur, school districts will need to take that into consideration to take protective factors into play, and also potentially make steps or take steps to reduce risk going forward. We pulled back, as we know, initially, and that had a big impact on our stay-at-home order in terms of preventing cases and saving lives. And so going forward, we know that that's still a tool in our toolbox that we need to maintain. It is the first tool, it's not the second tool, but we need to protect human life. So our agency also been very active in assisting districts with commencement plans and sports-related activities to ensure that prevention protocols are established and followed. On behalf of our staff that has been directly working with local schools, I want to thank all the representatives from the school districts that have been so patient and resourceful during this time. We've been impressed with the innovation of school districts working to try and provide a moment that our graduates can remember, and at the same time doing what they can to reduce risk as much as possible. Your willingness to work with us on behalf of the students and families and communities is really appreciated. I want to talk a little bit about contact tracing. We've talked about that from time to time. It's an important role in what we do in public health, not only in the current pandemic, but in public health as a whole. Historically, we've seen it used on a global scale to reduce the spread of smallpox, tuberculosis, measles, and the influenza outbreak of 1918, among other diseases. In public health, we've used it for centuries as a way to identify individuals who are ill so that we can do our best to isolate them from others and prevent the spread of illness. Identifying contacts also helps us to get in touch with people who may not know if they're sick and could be in need of diagnosis or treatment. Here at the Board of Health, contact tracing is a key component of our surveillance efforts. We have 4 tried and true components to this work. We detect, we diagnose, we isolate, and we contact trace. To date, we tracked over 8,000 people here in our health district. I'm very proud of the staff that have put their heart and soul into this response. By tracking people in contact tracing and cases and getting folks to stay home to monitor for symptoms, we're preventing further cases and stopping further chains of transmission in the community. We've been successful in doing this thanks to many factors, primarily the cooperation of those that have been directly involved, the individuals that we are tracing. Based on our experiences, we found people who are confirmed with COVID-19 to be compassionate and caring about the health and well-being of those with whom they may have come in contact. These individuals have been forthcoming with information. They've been as thorough as possible in recalling their whereabouts and retracing their steps, and have often reached out to their contacts to help protect them. They've been part of the public health answer to the COVID problem. This level of engagement is critical to not only protecting the people affected, but also the public at large. I want to thank each and every one of the thousands of people that has worked with us and have been so helpful. We could not do our jobs without you. So please pick up the phone when your health department calls. We'll ask you your name and birth date as a way to identify your identity. We will never ask for your social security number or any form of financial information. You can always check if you have a question. Call the health department, and we'll validate the person that's calling you is indeed a bona fide member of the public health workforce. From there, our conversation is focused on protecting your health and the health of others. So we're living in an unprecedented moment in history. We're experiencing in real time the collision of an international pandemic and the brutal killing of George Floyd, yet another heartbreaking demonstration of the plague of racism that still infects every fabric of our society. April 4th, 1968 is burned into the annals of American history when Reverend Martin Luther King was murdered on the balcony of his hotel room in Memphis. April 5th, 1968, the very next day, Robert F. Kennedy spoke to the Cleveland City Club. He said, reflecting on the courage, wisdom, fortitude, and martyrdom of Dr. King, Robert Kennedy said that when you teach a man to hate and fear his brother, when you teach that he is a lesser man because of his color or his beliefs or the policies he pursues, when you teach that those who differ from you threaten your freedom or your job or your family, then you also learn to confront others not as fellow citizens, but as enemies, to be met not with cooperation, but with conquest, to be subjugated and mastered. In that speech, some 52 years ago, he went on remembering that Reverend Martin Luther King described the riots at that time as the language of the unheard. He said that we should be doing a lot of listening right now. This time, we should not fail to hear what people are saying through their pain. 52 years ago, at this pivotal moment in history, the Cuyahoga County Board of Health stands with our community partners to declare racism a public health crisis. We have to open our hearts and minds to understand our own biases and our own privilege. This individual work is the first step in our collective journey to eliminate structural racism. At the Eternal Flame in Arlington National Cemetery, there's a marker on the gravesite of Robert Kennedy, and described with the following: each time a man stands for an ideal, or acts to improve the lot of others, or strikes out against injustice, he sends forth a tiny ripple of hope. And crossing each and other from a million different centers of energy and daring, those ripples build a current which can sweep down the mightiest walls of oppression and resistance. It's time for us to face our original sin of racism. We must become more aware of our assumptions about people, places, groups, political and social structures, to understand how and why these assumptions limit our view of the world around us. Only then can we truly change.
Good morning. Thank you again to the members of the media who are here and also working from your offices and homes. We appreciate your continued support in covering the impact of this pandemic on our community. I cannot brief you on the status of the COVID-19 pandemic's impact on our community this morning without first discussing the impact of the larger epidemic in this country that has killed far more people than coronavirus, and that is racism. Racism has been a part of this country since the very beginning and is the root of profound differences in opportunity for people of color that lead to unjust, preventable health outcomes, such as a high burden of chronic disease and early death. You've seen this week that thousands of individuals have exercised their First Amendment rights to nonviolently protest for racial justice in the wake of George Floyd's murder. We have worked here at CCBH with partners across the community for a number of years in HIP Cuyahoga, and where in 2015, we first collectively declared eliminating structural racism and fostering racial equity our shared priorities. That remains the cornerstone of our work as a community with stakeholders across many sectors who share the vision of making Cuyahoga County a place where everyone has an opportunity to reach their full potential. This is not a matter of right or left along the political spectrum. This is a matter of our shared humanity. Today, though, I want to share some insights from my own life as a Northeast Ohio native, a mother, and a physician. I am white, which means I was born with privilege. The privilege associated with being white is automatic, given the context in which we live in the United States. I have seen images that look like me everywhere I look since I was very young. Products are designed for my skin color and my hair type. I can do everyday activities without fear of bias. As a white physician, I can walk nearly every place in a hospital without being questioned. That is not the case for individuals of color here or in communities across the country. It has long been time for those of us with privilege that confers us undeserved power to do the necessary and uncomfortable deep work of understanding, personally confronting, and collectively eliminating racism. From implicit bias in our personal interactions and behavior, to changing systems and policies that perpetuate structural racism and maintain our privilege. As a member of the dominant race, silence and inaction are not options. Every single one of us has a role to use our hearts and our minds in our spheres of influence to catalyze change. This requires transformation of our deeply ingrained perspectives about race. This includes learning the historical roots of racial inequity in this country, not the sanitized versions we learned in school, but the actual truth about this country's history. As a first step, sign up for a Racial Equity Institute training right here in our community. It will be 2 days that radically transform you. Build authentic relationships, those of mutual respect, predicated on trust that's earned over time with people who look different than you. Talk to your kids about racism now. Take a look at your workplace, your place of worship, the businesses you patronize. Do all the people there look like you? Speak truth to power. Take a stand for inclusion in those places, regardless of the personal cost. Patronize businesses owned by people of color and those who are different from you. Listen to people of color. Really listen to them. Listen to what they experience every single day and what those with lived experience truly believe is necessary to move all of us as individuals, as a community, and as a country to be better. These activities are just a few, and they're certainly not sufficient, but they can be done right now, right here, and they'll begin to give you a glimpse into the everyday struggle of people of color in this community and in this country because of racism. The time is now to use your voice, your privilege, and your power for real change. I often hear from individuals when we have these discussions of race who are white, who say that their lives have been hard, and that's truth. But this conversation about racism in no way invalidates your experience of struggle in poverty or other difficult circumstances. But what those of us who are white need to understand is that our struggles are not made more difficult by the color of our skin, and we are afforded privileges we don't even realize because we're so used to being in power, even when we find ourselves in tough circumstances. It will take all of us to work together collectively to change our community and our nation into a place where everyone has the opportunity to reach their full potential, regardless of race, ethnicity, gender, religion, language, sexual orientation, or any other non-majority demographic. As a physician, I see firsthand the effects of the brokenness of this world through the immense privilege of partnering with patients in their lives. I frequently reflect that the issues contributing most intensely to poor physical and behavioral health are not actually anything I learned how to manage in medical school or residency, but rather They are issues of racism and poverty. Those are the actual causes of illness and death, and those are the very issues we must work together to solve as individuals and as a collective community. It begins with each of us right now. In my moment of gratitude today, I would like to conclude by thanking countless people who have influenced my personal perspective transformation journey around understanding racism, helping me better understand their experience as people of color and my role in this as a white woman of privilege. I regret that I cannot name everyone here, but I want each of you to know how profoundly grateful I am for you spending time you didn't have and that I didn't deserve to educate yet another white person about this issue. I cannot imagine how exhausting that must be day in and day out, but I'm personally grateful for that sacrifice. I specifically wanted to mention two physician mentors at Wright State who guided me through medical school, Dr. Alonzo Patterson and Dr. Rhea Rouser, who believed, I don't know why, in a naive white kid in our early 20s. They spent a great deal of time personally pouring into me. I also want to thank my longtime Hip Cuyahoga co-chair, Greg Brown, an incredible leader in this community for many decades. He has generously given of himself in catalyzing my understanding of what we all need to do together. Finally, I want to thank all of my patients, but particularly my patients of color, who have given me a great deal of trust as a white doctor, trust I didn't deserve and hadn't earned, but which you so graciously gave. You have all taught me so very much, and I thank you for your mentorship. These relationships and many others have transformed my life and my understanding of race and privilege and my role in fighting for change. And for all of that, I'm grateful for these eternal gifts. With that, we will pause for the cameras to pivot to the data slides, and I will move on to the data update. Okay, 4 thumbs up. We can go. Our case summary for the CCBH jurisdiction is lab confirmed cases are 2,841. Probable cases, 587. Total cases, 3,428. Date of illness onset stretches from February 28th to June 2nd. Recovered cases continue to rise, something again to be celebrated, 1,248. And the number of identified contacts is at 5,302. Age range for our cases remains at 1 week to 102 years of age, and our median age remains at 51 years old. 57% of cases are female and 43% are male. Hospitalizations at any point during illness are 531. One of those is pediatric, and 530 of those are adults age 19 and over. ICU admissions, meaning people who needed intensive care support, are 144, and those are all adults, ranging in age from 20s all the way up. This is the cumulative slide showing counts from the middle of March when this first occurred in our community. Red indicates total case counts, blue indicates total recovered individuals, and green indicates people who have lost their lives in our community from COVID-19. This slide I first presented last week, and this involves understanding the number of new cases as compared to the prior week. So what our hope is this would just give you a general idea of the number of new cases since the prior time we spoke with you on Friday. And this information has always been on our website, but we wanted to provide it to prevent you from having to do calculations. So you can see that when I presented last week, we had 484 new cases since the prior Friday. And this week we have had 365 new cases since the prior Friday. And those are, as you can see, in red. In blue, it's identifying the number of reported recovered cases since the prior week. So very similarly last week and this week, we've had 178 people recovered during the week. And in green, you'll see the deaths reported since the prior week, and there were 31 reported since last Friday in our jurisdiction. And again, these data do not include the city of Cleveland. Our partners there report their data separately for this particular part. Just about 21% of our cases continue to be in healthcare workers. We are improving slightly on the unknown status as we get new cases. It's hovering around a quarter of cases, but we continue to gather that information as we interview more people. About just over 40%, which is a pretty stable number for us, of the cases have a pre-existing condition. So those are conditions which make you more at risk for complications, such as lung disease, heart disease, diabetes, cancer, and other similar conditions. This is the racial and ethnic breakdown of all of our cases. This includes our lab-confirmed cases and our probable cases. And you will see the graph format of these data on the next slide. Nearly 2% of our cases identify as Asian. Nearly 41% is Black. 44.5% is white. 4.3% identify as other. And our race is unknown in 8.5% of our cases thus far. For ethnicity, 2.5% of our cases identify as Hispanic, Latino, or Latina. 75% is non-Hispanic, non-Latino. And just over 20%, we don't have known ethnicity. This is the same information in a graph form, and this will be available on our website shortly after the press conference concludes. This is the racial and ethnic breakdown of recovered cases. 52% of recovered cases identify as white, 36% is Black, 3% is Asian, 3% is other, and in 5% of the cases we do not know the race. 82% of those recovered identify as non-Hispanic, non-Latino, 2% as Hispanic, Latino, or Latina. 16% of those cases is unknown ethnicity. This is the race and ethnicity breakdown for hospitalizations. This constitutes 531 cases. 48% of the hospitalized cases identify as being Black, 43% is white, 5% is other, and 2% is Asian. 81% of those hospitalized identify as non-Hispanic or non-Latino, and 3% as Hispanic or Latino or Latina. For intensive care unit admissions, this constitutes 144 of our cases. You'll notice that 49% of those in the ICU identify as Black, 43% is white, 5% is other, 2% is Asian. 84% identify as non-Hispanic or non-Latino, and 1.4% identify as Hispanic, Latino, or Latina. I want to remind everyone that we continue to have a devastating toll of death in this community from COVID-19. 215 individuals have lost their lives due to coronavirus here, which is 205 individuals who were lab confirmed and 10 probable. dates of death stretch from March 20th to June 3rd. And we pull these data the night before the press conference, but we had more people who were deceased overnight as well. So we actually have had deaths also on June 4th and June 5th. The age range for those who are deceased is 36 to 101. The median age remains at 81. 53% of our cases who have died are female and 47% male. This will also be in graph form in the next slide, but 1% of those who've died identified as Asian, 25% is Black, nearly 71% is white, 0.5% other, and almost 3% we don't know. That is much improved, as is the unknown for ethnicity. We've worked very hard to understand these demographics so we can better create an equity-grounded approach to this response. For ethnicity, 0.5% of the cases who have died identify as Hispanic, Latino, or Latina, and 96% non-Hispanic, non-Latino. This is the same information in graph form, and again, will be available for your viewing after the conference. This is just a reminder of the curve as we present the epi curve, nothing new here. This is our epi curve for our jurisdiction over the past few months. You can see we have a very similar distribution as we reported last week. In red, you see both lab confirmed and probable cases by the date of illness onset, and recovered cases by the date that they were discontinued out of isolation. This map represents combined cases for both the Cuyahoga County Board of Health and the Cleveland Department of Public Health. As you can see, both of our logos are on here, so that will help you remember that this is the whole county. You can see that we continue to have darker green areas where more cases are identified. And as a reminder, these are the number of cases in the zip code where the person identifies as living at the time of the case diagnosis. Moving on to county level hospital utilization. I have this in graph form on the next slide. The use of medical surgical adult beds is at 76%. This is an increase of 3% from last week. For pediatric medical surgical beds, we're at 56%, which is a slight decrease of 1%. Critical care beds are at 72%, which is a decrease of 2%. And ventilator usage is slightly up 1% to 32%. This is the same information in graph form. Finally, on testing. I promise, I have asthma. This is not a COVID cough. Just making sure everyone in the room is aware. Clearly forgot my allergy medicine this morning. This week, our total tests were at 15,349 as compared in bold to the prior week, which was 13,310. And I did graph this, but it really wasn't a very exciting graph. So I'm just leaving you, I ended up not including it. I'm leaving you with just the numbers. Bottom line is, among the 3 hospital labs, we're doing a similar number of tests week to week. And this includes the tests for the community testing strategy supported by our county executive and his team of about 1,600 tests since that effort began. The total positive rate is actually, percent positive has gone down a little to 5%, and the range this week was actually 4.8 to 5.6 among the 3 hospital labs, which is actually much closer than they have ever been in prior weeks as we've been tracking this. I think that's a reflection of more people, community dwelling outside of the hospital being tested. We would expect a lower positivity rate with those tests. And finally, the Ohio Department of Health released new testing recommendations for the state this week. And so I posted this updated testing infographic just so that everyone can be updated on the most recent recommendations. There are now 5 priority recommendations. However, only priorities 1 through 4 are recommended to be tested at this time. Priority 5, which is asymptomatic individuals who don't fall into one of the other 4 categories, are not yet recommended to be tested in the state of Ohio. And we will continue to update you as those recommendations change. From a public health department perspective, our community testing strategy is heavily focusing on priority 2 and priority 4. The other priorities 1 and 3 are mostly related to hospitals and their testing of individuals in the hospital, their workforce, as well as people receiving surgeries or procedures. So with that, we'll pause to allow the cameras to position again. If you can just wait until Heather finishes, and then we'll restart with Ramona.
Good morning. I just want to acknowledge how difficult this week has been for many Americans, coping with the aftermath of George Floyd's brutal death and subsequent protests across all 50 states. For some, this has been a time that has led to deep soul searching and has challenged many people's notions of racism. For African Americans, this time has been a forceful infliction of pain that is layered upon the unhealed generational trauma of racism. I cannot explain what it means to fight for your existence in every space you enter, often with people who have no authority over you, whether it be going for a jog, walking in your neighborhood, picnicking at a park, shopping at a store, being in your own yard, in your house, at the gym, or at your job. I've learned your numbers of years of education, the credentials behind your name, or years of experience in your profession cannot save you from the constant expectation to prove why you belong in the space you occupy. In the midst of a pandemic where we continue to see disproportionate impact of COVID-19 on African Americans, this time has become even more unbearable. To learn through reports that Mr. Floyd had survived COVID-19, but not the cruel hands of racism, is too much. But as difficult as this time is, we still have to remind ourselves to do as much as we can to reduce our risks of acquiring COVID-19, like good hand washing, continuing to wear masks, staying home when you are sick, practicing physical and social distancing as much as possible, and being open to getting tested if need be. The ways we've learned to cope with and survive the pain is to bury it, to suffer in quiet moments alone, and then figure out how to go back into the world with hidden pain. This week's past events for many have ripped open wounds, deep and raw. Many of my friends have shared their own stories of encounters that exude pure mental anguish. When we hear the stories and we see the images, we cry for them, and we also see ourselves, families and friends, and worry that our lives will be ended in the same way. It's a feeling of being powerless and unable to protect yourself and your loved ones. But many African Americans went to work anyway this week, trying to keep it together, myself included. We are taught to be strong, just deal with it, to accept the quiet and loud indignities, or fear losing your job, your freedom, or your life. But this way of coping has its toll on mental well-being, and it also contributes to the chronic stress that we have previously discussed and the development of chronic disease. Addressing mental health is often taboo, but the message I would like to share today is that it is okay not to be okay. To feel the range of emotions from sadness, fear, anger, and despair. To take a break from the news and social media when it becomes too much. To talk to a trusted friend or family member. To prioritize self-care and mental well-being. To find comfort in your faith and faith leaders. And to seek help if you need to talk with someone. So finally, I would just like to leave a few resources for people to use if they are experiencing stress or anxiety. People can call the 24-hour warm line for Cuyahoga County at 440-886-5950 to talk with a peer, or can contact through a text by texting the number 4-HOPE to 741-741. And if you are in crisis, seek help through the 24-hour suicide prevention hotline at 216-623-6888. With that, I'll turn it back over to Terry.
I've been proud to be here with this group today and every Friday, but particularly today as people spoke from the heart about an issue that we're confronting as a society, a central issue that we need to address, and we had the opportunity to do it in the face of this pandemic, with a real public opportunity, with coverage from the media, as we all do our soul searching as Clevelanders, as Americans. And so with that, I'd like to open it up for questions that you may have.
Been discussed to some extent, but the fact that the protesters have been gathered in clusters without appropriate social distancing and masking, how big of a concern is that to the Board of Health?
Well, I think from a public health standpoint, I think our first default is always prevention. We want to see people washing their hands. It's the I think it's the first day you're in class in public health, we talk about washing your hands, and nobody realized how right our grandparents were about that. We talk about surface cleaning, we talk about staying home when you're sick, and we know that masking is a good preventive measure to reduce the risk of transmission. We did see a number of protesters wearing masks, and we think that's good. Not everyone. We know that being outside certainly is less of a risk than being inside. Ideally, we'd like to see everyone masked. We understand in the moment there is a larger issue, a societal issue that is really at the center of this upheaval, this purging that we're going through. And so we understand in the moment emotion, history, and of the tragedy, the stress of the moment. People may forget to mask. We hope going forward that people try to do that, but I think I've seen a lot of instances in protests where people have been largely wearing masks. The more in the group that wear masks, the better the level of prevention, but it certainly wasn't perfect. And we're going to continue to encourage folks to take those preventive measures as they protest peacefully.
So do you expect to see a little uptick maybe in the next, in the 2-week window, I guess? Is there going to be more cases, do you believe, in this area?
So the question is, will there be more cases because of the issues around masking with some of the protests? And so I think that there are a confluence of things happening. We have indeed some that have not worn masks during the protest. We also have more and more venues opening up. We have more and more opportunities for testing in the community. We have more people feeling that it's summertime and all is right with the world. Let's go out and enjoy the weather. At the same time, we know that given our numbers, that COVID-19 is alive and well in the community and transmitting person to person. So all these things, I think, come to bear on our risk for transmission. And so I don't know that it would be one factor, but we have been seeing, as Dr. Gullett reported, this sort of waves, this undulation of cases. Up surges, then down surges. And so we anticipate that that may very well be our fate in the near term until the fall comes. And we continue to prepare, as we've said from the beginning, that we have to prepare for the potential for a long fall, perhaps 8 months of a flu season that may run from September to April. That's a long stretch. So that is the world we're in, and no one frankly really knows. There's lots of predictions, there's lots of suppositions, and there's a lot of great science, but no one really knows what will happen in the near term, given that this is a new virus. But we're going to do our best to continue to prepare and to send messages and remind people that being safe is prudent, and being safe is a sign of respect for your fellow citizens.
For county executive, more protests are planned this weekend. What is the sheriff's department, what is the county doing to make sure people will be safe and things will be protected this weekend after what we saw last weekend?
So again, I personally, and I believe that the county as a whole, county government as a whole, supports the peaceful protests, and we'll do our best to maintain the ability of protesters to come out and extend their messages and do it in a peaceful manner. Sheriff's Department is on alert, has been alerted to the possibility of more protests this weekend. They have, it's my understanding from the sheriff, that they have the deputies ready to go, and they will be positioned in places that are needed. The county serves as a support for the city of Cleveland, for the protests in the city. The city has the primary responsibility, and our sheriff's department will support them.
Do you guys have a damage estimate yet to public buildings from last weekend?
I don't, except looking around and walking around and seeing it. It's extensive, and it's very sad. Our Public Works department went out on Saturday. They were out there boarding up broken windows and cleaning up the damages even that day. And they continue to do it every day since then. But I don't yet have a damage number.
Any other questions? Thank you very much.